Good afternoon, everyone. I'm Dr. Jose Colon Rivas. I'm the Director for the Department of Families, Children, Youth, and Recreation for the City of Hartford. Thank you very much for attending the Mayor's press conference focused on early childhood obesity rates in Hartford preschool children. Recently, our Division for Young Children, under the leadership of Jane Crow, executed a contract with the Yukon Center for Public Health and Health Policy to convene a weight surveillance research study on children enrolled in Hartford center-based preschool programs. The results are a matter of priority, quite alarming. And I'm delighted that so many of you have taken time out of your busy schedule to listen to our findings and to address this issue. Without further ado, it is an honor for me to introduce to you Mayor Pedro Segarra. Mayor.
Thank you. Thank you. What can I say? The results of the study, the conclusions of the study are extremely alarming. It really brings forth a very strong need for a call to action that gets all the different partners working together to do a coherent and a comprehensive intervention of our young ones. This age group is an age group that is forming not only their social identity, but also developing habits that are long life habits that are being developed. So it is a good time to get our partners into a call to action to make sure that we coordinate all of the different services, and we have many providers here, to make sure that we do better. The issue now becomes how to strategize, how to develop a plan, how do we integrate our health department, our community partners, our Board of Education, our Recreation Department, to build up a series of programming, some of which is already existing, but how do we use and how do we leverage our recreation facilities to develop activities for our younger population? How do we use our early learning centers to provide parent training on issues related to nutrition? How do we use our health department to make sure that those children who are now at a much higher rate of risk for asthma, for problems with circulatory diseases, orthopedic diseases as a result of young bodies not being able to structurally support a much higher weight level. So it gets us into a situation of having now a strategic dialogue, and I think that once we get into the particular findings of this report, we're going to see that there really needs to be, at least at the local level, in cooperation with the state, a more aggressive agenda. The President and the First Lady have instituted a program of obesity that has tried to impact our children. We need to make sure that we do our fair share. We're dealing with a community that's for the most part more economically challenged, which create a whole set of problems that are different from other communities. So we're hoping that we can work together to make sure that we continue to deal with this. And not just in terms of childhood obesity, but also going into adolescence. Because adolescence is another period of time in which another important phase of self-identity happens. It is a time when a lot of the youth also gravitate towards smoking, which then creates further problems in terms of health and lifestyle. So let's walk out of here today a little bit more intelligent in terms of what the statistics are, but let's also walk out of here with a sense of commitment of working together. And the best results that we have gotten in the city in terms of issues that we have tried to deal with is using a collaborative impact model. Getting together, strategizing, having an agenda, making sure that we exchange information, make sure that we set a common set of goals, working together to create some progress. So thank you for being here today, and I look forward to hearing from the university and from the other folks here to make sure that we have everybody informed and take action. Thank you.
Thank you, Mayor Segarra. Certainly, we have a better understanding of the national trend regarding obesity rates in your children. But now let us really focus on looking closely at Hartford findings. And for that particular purpose, we have invited a great colleague, Dr. Ann Ferris, Professor of Medicine and Public Health for the University of Connecticut and Director of the Center for Public Health and Health Policy. Dr. Ferris.
Thank you, Jose. I'm really happy to be here today, and the university looks forward to doing many such projects with the city as we have been doing through the Urban Health Partnership for several years. So for this study, we measured 1,300 3 to 5-year-olds in 35 randomly selected preschool programs. So these children were weighed and measured 3 times, and then the average of that weight was used in the presentation. The children there was standard clothing for the children. They didn't have any shoes on and no heavy sweaters. And then we made an accounting for the average amount of the clothing. So this is about as accurate a measure you can get of childhood weight. What we found was that there was a far greater prevalence of obesity in Hartford than you would see from the expected Center for Disease Control guidelines, and also above U.S. prevalence rates. So of the children measured, 37% were overweight or obese compared to a national expected rate of 15%. 20% were found to be 17% were classified as overweight, and we would expect about 10% of children to be in that category. And more disturbingly, 20% were found to be obese, and we would expect only about 5% in that category. Of greatest concern to me when I looked at the data were the number of children who were above the 99th percentile, for both height and weight. These were children who were just way above the normal trajectory. So although Hartford Latino preschoolers had the highest rates of obesity, both African American and other ethnicities exceeded what was expected. So we really need to think about how approaches that we would make, and are actually things that are actually happening in the city right now, that really encompass some of these perhaps cultural differences in child feeding and activity practices. So one of the other things that we found is that boys and girls were exactly the same in terms of how they were categorized. Other places in the country have found that to be a little bit different. So the other thing that I was particularly concerned about was that the older children, the 4 to 5-year-old children, were more likely to be heavier than the younger children. And this is what you wouldn't expect physiologically, because this is a time when children are leaning out, and they naturally should lean out. So you have a child when they're younger, they're a little bit chubbier. Then when their appendages start to grow, they lean out, and they lean out through the early elementary years, and then they start to put on fat in preparation for the adolescent growth spurt. So what we're seeing in this population is many of the children are not going through this normal physiological change. But the message I want to leave with is that although this problem may seem insurmountable, there are solutions. It is feasible. The changes that you have to make in caloric content and activity, and changes in any expenditure, are very small. It's hard to do that. It requires some real transformation of systems. There's a lot of people in this room that I can see, friends on both sides, that are doing much of this. But especially in this age group and younger, it's doable. We can really prevent obesity at this point. So, but it's not just the preschools. We can't just we can't think of it being just happening in the preschools. All the other programs and all the other pieces of the child lives have to be involved. You have to think of the home, the healthcare system, and the participatory guidance given by the pediatricians, maternal and early child care, and faith communities, community environments, after-school programs, they all must engage to make this a workable initiative. Thank you.
Thank you very much, Dr. Ferris. As Dr. Ferris mentioned, I mean, the findings from this research correlate with national trends, but it is important for us, and there are many things that has to be addressed in Hartford, especially based on the findings. So I would like to ask the mayor to ask additional comments prior to our opening for questions. Mayor.
You know, 37% is more than twice the national standard in terms of obesity. So it really presents a real challenge in terms of how to provide for an intervention that gets us hopefully below the national average. We've implemented programs in the past, such as our infant at-risk program through the Department of Health, which took a population of mothers who were at risk for infant mortality, and with intervention lowered it even below. So we know that once we acknowledge and recognize the problem, that with proper intervention we can succeed. The challenges around this issue is the work that needs to be done in terms of educating our community. I know that in Spanish, and I'll give an interview later, when we see a child that's plump and apparently overweight and red, it's sometimes culturally is accepted as a symbol of health, when we know that the redness might come from already some arterial sanguinary type of problem. So we need a lot of work to do, but I'm confident that if we strategize around this issue, that we could do a lot better. So I want to just, before I get to questions, just do a little wrap up in Spanish, and then we can move to some questions. El propósito de esta conferencia de prensa es para anunciar los resultados de un estudio que se hizo de parte de la Universidad de Connecticut y nuestro departamento de centros de cuidado a niños de temprana edad, niños entre 3 a 5 años. Se tomó un número de niños que era el ejemplo, ¿no?, para la población en general en esta misma población, y se determinó que un 37% de nuestros niños en esas edades de 3 a 5 años tenían problemas de sobrepeso. El estándar nacional de sobrepeso son 15% de la población, en este caso eran 37%, o sea que tenemos el doble del nivel nacional en términos de obesidad infantil. Lo que vamos a hacer es, ya que tenemos resultados de este estudio, ver cómo los diferentes programas, departamentos y sectores que atienden esta población podemos coordinar esfuerzos para traer este nivel de obesidad menos, si podemos, de la cantidad nacional, que es como un 15%. Esto va a tomar esfuerzo en educar nuestra comunidad, educar nuestra familia sobre formas las cuales se pueden utilizar para prevenir la obesidad entre estos niños. Esta obesidad trae ciertos problemas de salud consecuentes, alta presión, problemas de asma, problemas asociados con las coyunturas de los niños y los huesos, y aparte presenta un alto riesgo de otros problemas serios médicos. Así que tenemos que trabajar juntos, y yo pienso que trabajando juntos, ya como hemos hecho en atender otros problemas, tal como la mortalidad infantil, que hemos tenido programas que han intervenido y han bajado las estadísticas por debajo de lo que es el estándar aceptable. Así que we'll take some questions, English or Spanish.
Mayor, do you have a timeline, like over the next several months or year, you plan to take this action? Or?
You know, I just got the study this morning, and already I will be directing our Director of Communications to initiate a series of public information to be aired on our public access televisions, and work with the Spanish media to present some information so that the community is aware of these findings and the risk that is involved in childhood obesity. I've already instructed our department head for the Department of Young Children to work with the Department of Recreation to try to augment the number of services by way of exercise activities for this population. Also, we'll be looking into working with other partners, the YMCA and other facilities that are available to try to continue to implement weight loss program for these children in a way that is safe. We've also spoken about meeting with the state WIC program and seeing how we continue to work with our state partners in terms of bringing forth information. A lot of this is education around nutrition and how to restructure the diets of these children in order to prevent an exacerbation of the problem. So there is a lot of work to do. Some will be done immediately, but my goal would be to establish a benchmark so that 1 year from today, we can have a benchmark that we would have established and work aggressively towards meeting that benchmark.
I have two questions for the professor.
Yes.
Just on the data. Could you talk a little bit, you said almost all U.S. cities share the same burden of preschool obesity as Hartford. Could you talk first a little bit about how Hartford fits in there? And then also, do you see nationwide in cities that are similar to Hartford the same differences between Latino children and African American?
Sure. I think for what we really see is that this is really an issue of poverty. And so cities across the country who have similar compositions to ours have similar rates. But I think on the positive side is that there are many places in the country where they've started to make changes after they have put in significant programs. The city of Philadelphia, the state of Mississippi, certainly California. There's a couple of other places where they have made significant decreases in childhood obesity after they've done some intensive programming. Now, there was a comparable study that was done among Head Start programs in Texas and Louisiana. And if you think about Texas, most of the Texas population that is Hispanic is Mexican American. There's a different composition, somewhat of the African American population that we have there. And in that study, the white children were significantly heavier than either the Latino or the African American. So I want us to be very cautious about ascribing really significant cultural issues. There are certain things that we all do and how we feed our children, but you think about the wide diversity in that population, in each of those subgroups, I think we just have to be very careful about any kind of significant blame because other types of national data aren't supporting that. One of the things I didn't do when I was just giving remarks that I just feel I can't go home until I do is to let you know who really did this study. I got to write some of it, but it was all done in about 2.5 weeks. Yep, 2.5 weeks with using well-trained UConn students, undergraduate students. Catalina Casada, who's one of the dietitian with the center, led that group with Julie Peterson. She had a couple of team leaders. We have our two statisticians, Dottie Wakefield and Beth Schilling, who did the analysis and made sure that we had an adequate sample size to say that this is really representative of the Hartford population. So, does that answer what you need?
It does. Can you talk a little bit though about how the preschool enrollment in Hartford being above the national average provides an opportunity for you?
Right. Actually, Jane might be able to tell you that a little bit. I was very surprised by how the high percentage, the 73% of the children in this age group are enrolled in center-based care. And that was and I got that number from Jane. And in many other parts of the country, they use more home-based care. The other thing is that we're a very focused, small area. A couple of weeks ago, I was in Nashville, Tennessee, and had gotten a lot of preliminary information in preparation for the meeting, which was exactly the same topic as we're having here. And I realized, I started to think about it, and all of their big intervention program is a county-wide intervention program. It's 526 square miles. And I was looking at all the plans that they were doing it and all the schools involved, and then I looked and I said, Hartford is 18 square miles. So, so what we're looking at, I think one of the effects of it is that we have a really dense urban population of a very similar income background. I mean, I live in Hartford. I'm a minority person in Hartford. So, but in some of those other areas, there's just a greater diversity of individuals within the metro area and how they define a metro area. But I don't know whether Jamie wants to say anything about the 73%.
The 73% of the children, preschool children that are enrolled in our early learning centers or preschool programs is largely attributed to the state's school readiness program that has enabled more parents to access affordable and easily accessible preschool programs. In addition to that, everyone I'm sure is familiar with the increase in the magnet schools, which also include preschools. So I think that is the reason for why there are so many of our children enrolled in center-based preschools.
Okay, so just on Jeff's question, what does that give you an opportunity to do with 3 out of 4 kids in preschool?
Would you like to answer?
Whoever wants to take it.
Yeah, absolutely. I mean, this is a community opportunity. In reality, I mean, it's everyone. We can not only say that we, the city of Hartford and the department, will be actually doing this. There are many individuals actually sitting in this room right now that are actually implementing action plans and doing something about this issue. So what we're trying to do, what we'll be doing, is actually looking at the findings and also looking at the resources that we have in the city of Hartford, looking at the individuals that are actually working towards this agenda, and then trying to correlate all those, trying to create a larger equation so that we can get into the end, which is what the mayor has said before, a year from now, we would like to see a decrease in these numbers. So I think it's a great opportunity for us to look at specific data, look at what our programs are doing for the children in the city of Hartford, and not only for the children, also for the adults. Most of the research that we read about obesity talks about basically the educational curve of learning, but also, we need to talk about misbeliefs. Sometimes the adults carry all those misbelief information that has been ingrained in our brains for the longest, and then we pass that information through different generations. And that's what most of the research is telling you. It's like we not only have to teach about issues and trends in obesity, but we also have to correct some of the misinformation that we have been passing through. So I think this is a great opportunity for all of us to work together towards a really key agenda in helping our children, adults, family, and community to learn about obesity in the city of Hartford.
Tengo una pregunta para el alcalde. ¿Me podría explicar de lo que la compañera estaba hablando de cuáles son me habló un poco de las medidas que se tomarán para atacar el problema de obesidad en los niños? Y también, alcalde, me gustaría que me hablara en términos de población de los niños latinos que se han visto afectados por la obesidad.
El estudio indicó que la población hispana tiene aún un índice más alto de obesidad infantil, y también sabemos que la población más alta de niños que están inscritos en estos programas son niños hispanos. Así que tenemos mucho que hacer en términos de utilizar los recursos que tenemos para implementar una campaña de educación, de adiestramiento y de recursos para las familias para poder reducir este índice de obesidad. Tenemos 77% de toda la población de niños de 3 a 5 años que ya están ubicados en un programa de aprendizaje a temprana edad. Así que tenemos un mecanismo por el cual podemos llevar ese mensaje. La posición de esta administración es de tratar de tener un 100% de participación de niños de edad de 3 a 5 años en estos programas. Estamos en un 77%. Entendemos que 10% de esta población no va a ingresar los niños, pero sí podemos tratar de incorporar un componente donde quizás podemos obtener participación, aunque sea un día en semana. Así que tenemos un reto, pero también tenemos una infraestructura existente para tratar de bregar con este programa.
Gracias, alcalde.
When I look at this perspective, one of the things that I'm most encouraged by is that we've worked individually with many departments in the city, and there are many dedicated people who've been developing programs. I'm looking down at the other end over there at the Department of Health and Human Services. But, under the mayor's leadership now, there's an alignment, and that alignment will allow for some transformation. It also will allow, there's some very active groups within the city, and now, it allows the time to align with them. The Hartford Foundation for Public Giving has funded a Hartford Wellness Alliance, and it's headed by Dr. Michelle Cloutier at Children's Hospital. The Hartford Food System is over there in the back row with Martha Page, trying to get healthy food into the community. Husky Sport, that's intensively working in the North End with Jenny Bruning. I know, I'm just looking around the room, there's many people that I'm not identifying, but I think it's important to know that there's a lot of activity going on within the city, and this gives us an opportunity to further align all of those efforts, and that's what I've seen in other cities. It's that alignment that really makes the difference, so that it's not all these little individual programs not making a significant, stable effort.
Question about Hartford. How will you invite economic development? A lot of the parents, a lot of the parents are undereducated or underemployed, and a lot of that has to do with poverty issues right now. How will they be partners?
Yeah, I think that we're going to also try to integrate this, and we spoke about this also earlier today. How do we integrate this with our Opportunities Hartford effort? The Opportunities Hartford effort is geared to affecting three areas: employment, income, and education. So it also provides an excellent vehicle as to how we use resources that are out there that can be maximized. For example, the earned income tax credit and other subsidies that can be utilized. How do we use the WIC program and integrate an education component that addresses issues of obesity? So even in a very difficult economic climate with some shrinking resources, there are things that we can do collaboratively to try to get a better outcome. But ultimately, it is a dilemma in terms of trying to get families that are lower income to be able to have access to quality, nutritious food, and at the same time get the education and the training in terms of how to have a more balanced and nutritious diet. So, this is our challenge now, how to use all these resources to make sure that we maximize opportunities for families, and that we work with Hartford Food Systems and other partners in terms of trying to access quality foods.
I just wanted to add one more thing. When the question was posed, what opportunity do we have with so many children in preschool? And the reality is that these are children that are in these programs 5 days a week, 6, 8, 10 hours a day. And so a lot of the variables that we typically do not have control over, we do have control with. So I think that's a big plus.
Well, thank you so much for being here today. Now we have the report. Now it's time for us to continue to strategize and collaborate and make sure that we live up to our responsibility to our children. Children of this age depend on adults and policymakers to move towards a better place, and that's what we'll attempt to do immediately. Thank you so much.